You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States.
Chelation therapy is a technique used to remove toxic substances from the bloodstream and is the mainstream method of detoxifying individuals who have been poisoned by heavy metals such as lead and mercury. Dr. Murray Susser, an expert in chelation therapy, explains what detoxification is.
Detoxification is a process the body uses to cleanse itself internally. You get toxic metals out of your body. You get products of metabolism out of your body. There's thousands of ways that people do detoxification, but what I like most is a controversial process called chelation. C-H-E is a hard C-H as in chemistry. And chelation uses the principle of metal binding. So you put a substance into the bloodstream that will bind unwanted metals like lead, mercury, cadmium, arsenic, and it binds these items and takes them out through the kidney mostly. Some of it goes out through the bowel. How does it do it? It does it by taking a metal binding agent like EDTA, and the EDTA goes in through a vein intravenously, and it binds unwanted metals like lead, mercury, cadmium. There's other chelating agents. I'm just using that as one example, but it's a good one because it's very safe. And it hooks on to unwanted substances like lead and mercury, and it floats it out the kidney. At that time, you cleanse organs in the body. You cleanse your liver, you cleanse your muscles, you cleanse your blood vessels. The things we put in the chelating bottle, we give an IV bottle with EDTA and other substances in it, like heparin and magnesium. And these are substances that fight heart attacks. There's a number of tests you can do. You can test the heavy metals that are inside the red cells, and that tells you a lot about what a person needs. You can test the metals that come out when they're challenged. These metals have a very long half-life in the body untreated. So untreated, if we have heavy mercury or lead, it might be 20 or 25 years before the body can get rid of just half of it. But what we can do is we can challenge with chelation. There's a form of EDTA called calcium EDTA, which takes the toxic metals out of the body. And we can then collect the urine, it's taking it out of the urine primarily. We collect the urine, measure the toxic metals in the urine after a period of time, and see what comes out. If a lot of metals come out, they could only have come from your body. And so we can get a very good idea there. When you do get detoxified, you probably prolong your life considerably, maybe 10, 20 years for the average person. When you get detoxified properly, you feel great. You feel 10 years younger, you feel 20 years younger, if you haven't been on a good detoxification process to begin with.
Dr. Susser explains how it works for the eye.
The eye is, like many other organs, but more so, is dependent on circulation. And the macula, for example, has one fine artery, the central macular artery, and it's about the size of an eyelash. And if that gets blocked up, then you get macular damage and vision. So the chelation goes into this artery chemically, and I believe it cleans out the inner layer of this tiny vessel, and the circulation improves.
Dr. Susser gave us a story on his patient's experience with chelation therapy.
I have a patient who was an 83-year-old retired attorney, and he was totally demented. He was unable to dress himself, unable to feed himself, and it had come on rather suddenly. I got with the family and said, this is a long shot, but let's try chelation. And I gave him chelation treatments. By the 20th treatment, he was reading. By the 30th treatment, he was driving a car again. And the 40th treatment, he wrote a book. And he had been totally disabled and totally given up. He practiced law for 50 years and never lost a case. And then here he is, totally unable to take care of himself after a relatively small amount of treatment and expense. He was back living a high-quality life. I became a family physician, and I did family medicine for a number of years, gradually including alternatives like nutrition and particularly chelation. Started chelation back in 1975. I was president of ACAM, American College for Advancement in Medicine, and that's the organization that kept chelation and other important intravenous alternatives like vitamin C, for example, and lipoic acid. All those are available now because of the work we did 35 years ago to keep it afloat.